I'm a practicing cardiologist in medicine for a little over 23 years. Though I look like Doogie Howser, I really have been doing it for that time. And the first 10 years or so were not such great years. Though on the outside it looked like I was very successful. I was an excellent doctor, I was respected, I was working hard. The inside was a very different story. I was struggling with stress and overwhelm, and I started to find that the name for it was actually anxiety and depression. And so I secretly was seeking help for these things while pretending like I had everything together. And after about 15 years of that, it took its toll, and I reached full-blown burnout and continued to work. I continued to see 2,000 to 3,000 patients per year. Not being able to talk openly about any of this, my mental health struggled, my family saw the effects, my friends, and so I've committed myself and the rest of my career towards not only helping my patients heal their own hearts, but also helping nurses and doctors and healthcare leaders around the world find a better way. On the one hand, we're talking about stress, loneliness, and anxiety, which affects so many of us right now during the pandemic. Doctors and nurses and people in healthcare are facing something very specific, which is a healthcare-related burnout. And many of my patients are surprised to know that this is an epidemic. If you were to survey all the doctors in America right now, 900,000 plus, you would find that every other doctor is burning out in some way or another. And what does that mean, that they're burning out? It's not just they're feeling a little bit stressed. It means they're feeling like they can't do their job well. It means they're starting to treat other people not as people anymore, but almost as numbers, trying to get through the day with a sense often of cynicism, what we call depersonalization. And then the most obvious, the thing that we can talk about most easily is exhaustion. Your doctors are tired. This pandemic has taken its toll. There's been staffing shortages for nurses who've been traveling. There's been overwhelm. There's been an increased number of deaths related to COVID. And facing that crisis has been incredibly hard psychologically and physically. So recognizing that half of doctors are burning out, 1 in 5 doctors have plans to leave their practice within the next few years. And by the year 2030, this country is expecting a shortage of over 100,000 doctors. This is going to be a major crisis for our country unless we get serious about it now. This was even before the pandemic. The numbers are going up rapidly. When it comes to addressing the crisis of burnout, we can break down interventions into sort of 2 groups. There's the most important, which is don't blame the individual doctor or nurse. Don't say there's something wrong with you. You need to be more resilient. You need to toughen up. That's not the solution right now. That's going to make problems worse. We recognize that at least 80 or 90% of this crisis relates to organizational features. So healthcare systems haven't been respecting and honoring the basic needs of doctors and nurses. And of course people are going to burn out when they don't feel respected, when they feel overwhelmed, and when we don't have the resources. So that's the first large area that we need to focus on when it comes to healing the burnout crisis affecting healthcare providers around the world. The second large area is the individual. We are resilient people who go through all this training, 10, 20 years of training to get where we are. We didn't make it here by lounging. However, sometimes some of the traits and the habits that got us where we are, that led us to success, like working hard all the time, never resting, not asking other people for help, those are the very same habits that get us into trouble when we're struggling with stress and burnout. And so we have to do some individual work as well, looking at what are our habits of thinking and of feeling, developing skills of self-awareness, of mindfulness, of self-compassion, and developing the ability to become empathic with ourselves and empathic again with our patients so we can reconnect there. Ultimately, the point of all of this is to get doctors and nurses who are burning out back to that place of centeredness, of feeling grounded and strong, so that they can effectively help change our healthcare system for the better.